huge honor for me to be interviewing a rock star in dentistry, Shelley Canada. I have been, you're just, I mean, I'm going to read your bio, Shelley. It's amazing. Dr. Shelley Canada has practiced family and cosmetic dentistry since 1989 when she graduated from the University of Oklahoma College of Dentistry with awards in operative and pediatric dentistry and was #1 in her class in Crown and Bridge dentistry. She has been licensed in Texas, Oklahoma, and Louisiana, which I didn't even know in Texas you had to have a license. That's news to me. And she is, joke, and she is oral sedation certified in Texas. Dr. Canada completed a 1-year general practice residency at the University of Texas Health Science Center at Herman Hospital, the University of Texas School of Dentistry, Texas Institute of Research and Rehabilitation, and Ben Taub Hospital in 1990. She then completed a 1-year cosmetic dentistry fellowship with Reality Publishing and Aesthetic Dental Professionals Michael B. Miller, who was the founder of Reality.
Right.
I haven't heard from him in a while. Is he still rocking and rolling with Reality?
He's doing awesome. He's actually teaching at the dental school now. He's kind of taken his career into the teaching field because, you know, when you've done everything, you got to teach it.
Tell him I want to podcast him.
I already have. I'm going to set that up for you.
And his wife's an orthodontist. Is Ingrid?
Ingrid, right.
I love Ingrid. She's a sweetheart.
She's the best.
Shelley has been in private solo practice since 1995. In 1995, she was named Young Dentist of the Year, and in 2009, Dentist of the Year by the 9th District Dental Society when she was past president. She was nominated for the Texas Dentist of the Year in 2009, and for many years has been named a Texas Super Dentist and a Houston Top Dentist, along with several other national awards. Dr. Canada is a fellow of the American College of Dentists, the International College of Dentists, and the Delta Sigma Delta Dental Fraternity, which I assume is just a drinking club, right? Where she has served as a national officer. She is also very involved in the Seattle Study Club in Houston, the West Side Study Club, the 9th District Dental Society, the Greater Houston Dental Society, the Texas Dental Association, and Delta Sigma Delta Dental Fraternity. She is a mentor to many past, present, and future dental students as well. Dr. Canada's hobbies include hiking, travel, creative memories, scrapbooking, jewelry making, crafts, Girl Scouts, and spending time with her beloved daughter and family. She's also on the Community Girl Scout leadership team and is PTA treasurer for her daughter's high school in Houston. Shelley, you have been a rock star for 3 decades. I mean, really. You are amazing. And the reason I wanted to get you on here is because if I look at the data of who's emailing me, howard@dentaltown.com, after these podcasts, I mean, really, Shelley, they're all under 30. I mean, I think a podcast thing is a kid in a cell phone, and she's either sitting in the back of the dental school lecture listening to podcasts or surfing Dental Town if the lecture's boring, or they're just got out of school. And you have really taken a focus at mentoring young dentists. Along with celiac disease in dentistry. But I just wanted to start up, and I wouldn't even need to ask you a question, but what would you tell these young kids? Because what they're telling me is they're scared. They got a lot of student loan debt, and they basically don't know what to do. And some of them are wondering if they even made a bad move, like maybe when you and I got out of school back in the day, that was the glory days of dentistry in the 80s, and now they are 2016 and they went down a wrong road. What would you say to a young dentist if she said to you, Shelley, do you think this was a bad move, becoming a dentist?
Never. I mean, I love dentistry. I can't even imagine life without it. So that's to go back and say I do something different. I've never regretted it for a day. There have been days where you think that. Everybody always questions, why am I here now? But you're never, how do you put this? Like, if you question, you're going to question everything in your life. You question, am I a good mom? Am I a good leader? Am I a good neighbor? You always question everything you do. But if you really like the technicality, if you're good with working with your hands, I think dentistry is the perfect option. I've gotten calls of dentists, young dentists who've called me up, who quit other careers like engineering and things like that and went into dentistry, and every single one of them has said, you know, I hate this, I hate my job, you know, they're not doing it right. And my word to them is, I had the same crisis conversation with my mentor, And I said to, the young dentist who called me recently, you have to keep looking for that right job. If that job that you have is not making you happy, you keep looking. You keep that job until you find something better. But my mentor said to me a long time ago, if you don't do it right and you don't feel good about what you've done, you call that patient up and bring them back in and do it the right way. And if we would all continue to stand for our ethics and morals that we know are right, we're gonna have the job that we love. And if you can't find the job that you love, make the job that you love. Going out on your own.
I think it's very interesting because I can ask you this because I'm a boy and you're a girl, but it seems like a lot of the boy dentists, when they're trying to find an associate job out of school, they're only looking at the money, and their questions and emails to me, it's money to money percentage. Or like, this guy pays 35%, and I got to pay no lab. It's just money, money, money. And the girls seem to be more intuitive and intelligent of saying, well, do I like this office? Do they have fun? Is this going to be a fun place for me to be happy? And man, I'd rather take a 25% ding or a 50% ding in my pay any day to be happy over just bringing home bucks and being miserable.
That's the bottom line. And when I had a job one time, the staff I was really young. I mean, we're talking 26, 7, somewhere in there. And the staff was not treating me right. I'd been there maybe about 3 months, and it was just seemed to be going downhill, and I wasn't happy, but I love the guy I work for. He's still kind of a mentor to me now. And I went into him and I said, I don't know what I'm doing wrong. I know I'm not a good boss yet. I know I don't know how to direct employees yet, but what do I do to get them to respect me? And best advice he ever gave me. He said, I want you to go around to every single employee and sit down with them for 4 hours during the course of a week. And don't tell them you're doing this, but go sit down with them and tell them, show me kind of what you do with your job here. Show me, some of the things you have to do. Who do you call? Can I just listen in and hear how you do your job? And I sat down with every single employee by the end of the week, and I also did some of their job too. I'd say, let me call and let me see what I can find out from this patient, what if I apply what you just taught me. Every single employee by the end of that month, I had like 4 or 5 people I had to go sit with. Everyone treated me like way better than they treated him because they saw my work ethic, number one. They saw that I was committed to them doing a good job and that I saw how hard they work. So now when I go running up and throw charts at them, fix this problem, fix that problem, I can go, why don't you fix this problem after you finish your stack of recall cards or after you do that insurance verification. I knew what their job was. So now, and also if I don't know how to do something, I now know exactly what staff member to go talk to. That was the best advice anybody ever gave me. And you really get to know that person. And I mean, my relationships with that team went out the roof after that. Best thing I ever did.
But, when every dentist went out and watched that new Star Wars movie, they just sat there during the whole movie fantasizing of the day that we can just hire droids to run our office. Fire all the staff and hire R2-D2 and CP3O and all that stuff. Wouldn't that just be awesome if those were all your staff? Yeah. Well, Shelley, you're a much better and more expert on mentoring these young kids. What kind of dilemmas or questions are you hearing? What are you hearing on the street when these kids? What dilemmas are in their life when they're wanting mentorship? What are the
number one thing that I'm always usually disappointed. Okay, like I write every single year for like 7 or 8 years. I've had a group of 20 to 25 students that I mentor. They come to my office. I email them probably every month or couple of weeks. I'm constantly in contact. We have sit-down sessions through the International College of Dentists where we go over ethical dilemmas. And, my partner and I, Tommy Harrison, we sit there and explain to them all of these ways that we've handled it, how we've had to deal with unethical drug abuse and alcoholism in our colleagues, and what do you do, how do you handle that when you're working with somebody who's doing terrible dentistry. We go over all of these dilemmas with them. So we really establish rapport with these people. I, every time, invite them in. Come in at Christmas, come in at spring break, come spend the summer with me. Come do any, if you want to just, if you have a day off, call up and see if we're doing anything interesting. And do you know how many people take me up on that? So far since November, one person.
I know it.
It's sad. They don't make any effort. Back in our day, if you could get a contact with an outside dentist, man, you develop that relationship. When someone begs you to call them and come into their office, take them on. And if no one's begging you to do that, then you need to go out and farm those connections. Ask a couple of people. Go ask the people at the dental school, who are you good friends with that they might let me come in and observe in their office? Because the more outside people you get in touch with, the better dentist you're going to be. You need to have the vision of what a good dentist looks like.
So are these students from a dental school? So you're in Houston. Is this a dental school up the street from you in Houston?
It's down the medical center in the University of Texas School of Dentistry.
And so you're doing this with that dental school,
right?
Arizona has two dental schools in my backyard. One's in Mesa and one's in Glendale. And I just have to tell my listeners that over the last decade, that like two kids that had the gumption to drive down and say, hey, I want to meet you. I've heard about dental town, this, and I just wanted to shake your hand, whatever. I can tell you that 5 years later, those guys they're all in the top like 1/10 of 1%. And now I tell them that when they come by, I say, just the fact that you walk through my door, I can guarantee you, your cream will float all the way to the top.
Yeah, and even if you're scared, I can't make it any less scary, and they're still too scared to contact me, and that's crazy. I've only heard of one time where a student contacted someone and had set up a mentorship thing for a day. And when she called to confirm, the dentist said, well, we're kind of busy. Why don't we'll do it some other time. And the dental student then went in the phone book and said, I've got this time available. I want to see who I can mentor. Calls at my office. My staff at the front desk knows that I'll take anybody, dental assistants, hygienists, they've all come in and observed in my office. And if they call me up, I'm going to let them, I'm still good friends with that dentist to this day. She's my patient, in fact. Anytime she has a problem, she calls me up, I talk her through the contracts. I do any kind of support for her because I believe in her. She took the effort to cold call somebody and say, I'd like to come in and spend my weekend with you.
So what type of ethical dilemmas are you hearing?
Oh, mostly it has to do with production. They're in there saying, why didn't you do a root canal on that crown? Why didn't you just go ahead and do an onlay instead of that filling? Why didn't you? A lot of it is, and this is kind of my pet peeve about dentistry, a lot of it is wives who get involved in dental practices. And they start penny pinching and running the show. And a lot of young dentists want to deal with the senior associate. They don't want to deal with your wife. Wives aren't the person trained in business and dentistry. They're just all about the bottom line. And that's okay, but I also think that a lot of these these associate dentists need to step in and groom the young dentists. They call me up and they tell me problems they're having with the staff and all of this. And my bottom line is always go back and talk to the senior associate dentist. Chances are they've had the same problem with that staff person. And they can either go talk to the staff person or they can sit down and do a three-way between the three of you and come up with a solution that works. So
Are you hearing are you hearing good or bad about corporate dentistry? I know when we got out of school in the 80s, a lot of people that just wanted a job, they went to the Army, Navy, Air Force, Marines, and it was all well respected. They had all kinds of CE stuff. I know that there's 450 DSOs, so you can't label them all one thing. But what are you hearing about the ones that are getting jobs at DSOs first couple of years out of school?
those, good and bad, a lot of them won't talk a lot of smack on them because they don't want to blow their connection, if they start saying something bad. But almost inevitably, I hear they're not getting the equipment they need, like the burrs, the polishers, impression material, things like that. I worked at a clinic per se. When I was working at Reality, that was only a 2-day-a-week job. I was making like $600 a month. I couldn't pay my bills on that. And so I got a job the other 4 days a week at a clinic, that takes a lot of PPOs and DMOs. And my favorite part about that job was going out and working in a DMO situation where, I didn't get a lot of extra money, but I really got to get up my skills, my speed, how I talk to people about insurance. I learned more about insurance in that job than anything else I've ever done. I've also learned how to, when you go and you work at these corporate jobs, one thing I noticed was, this sounds bad, but the staff was more inclined to give the male dentist patients than the female dentists, because when you look at it from their perspective, I mean, where's your future going to lie? You're single, you're high school education. There's a hot young doctor here. If I pad his schedule with great patients, maybe he'll like me better. They had a lot more incentive to pad the male dentist schedules than the females. So that was my experience back in 91, I believe. That was when I was doing that job. I didn't like how they would take a DMO patient, they'd call in and they'd say, I need a cleaning. They would take my blank schedule, flip it ahead 3 months, and say, we can see you for your cleaning on March 14th at 3 o'clock. I'm sitting there watching them do this going, no, I got scheduled today, 4:30, bring them in, They're like, no, be quiet. All right, we'll see you then. They hang up the phone. I said, well, why didn't you bring them in at 4:30 today? They go, because, don't you get it? If we scheduled them 3 months out, we get 3 months of payments. Then we don't call and confirm, so they forget. So when they call back, we say, it'll be another 3 months. So now we're about 6-7 months down the schedule. I've gotten enough payments to now we can afford to do your cleaning.
So so those were the HMO capitation payments where they were paying you $9 a month per person. And I want to say something. What I thought was insidious about that is, back in the day when I got to school in '87 and this capitation started, where the insurance companies were all saying, well, what we're going to do is we're going to transfer the risk from the dental insurance company to the dentist. So we're just going to give you the money each month and you take care of them. But the indemnity insurance was collecting $20 per head, and the capitation was $9 a head. So it's like, okay, well, you're mixing two variables. You're transferring the risk from the dental insurance company to the dentist, but then you cut his money in half. And I always wondered what would have happened if they just would have said, let's keep the money the same, but transfer the risk from the insurance company to the dentist and say, hey, we'll just give you $20 a month per patient. The average dentist has what does the average dentist have? 1,800 patients, 1,800 active patients. So 1,800 times 20, that's $36,000 a month times 12 is $432,000. I can't believe I figured that out because I haven't taken geometry for 30 years. But so that that might have really changed diagnosing and treatment plan, because you were talking about earlier where some of the ethical issues is the bottom line. They want you to do crowns instead of MODs. I mean, some of these people that are out there doing these huge numbers, they haven't done an MOD filling in 20 years. Everything's a crown, a crown, a crown, a crown.
Right, right. No, I love and do lots of big fillings in my private practice. I'm good at it. It's what I like to do. I like to use different kinds of products, what I've learned through reality. It's, I can't ethically sit there and a patient I know is financially strapped. What I'll do a lot of times is I'll say, okay, I'm going to stop the caries. We're going to do a big build up here. And I've got to run over on the other side and do that root canal and that crown on that tooth. And then once that's going to eat their insurance for the whole year. And then when at January 1st, we're going to go back over here and crown that big MOD on number 12. If I feel like it needs it. Sometimes they're really small. Sometimes you have a mesial box and a distal box, and you don't need to sit there and crown a whole tooth.
Shelley, I want to keep asking you questions that I can ask you that I can't ask a male dentist. In my lifetime, I'm 53. I watched when I was a little kid. I grew up with a mom and 5 sisters, and all the OBGYNs were men. And now it's transferred to pretty much it's all women.
All women.
And we're seeing the exact same thing in pediatric dentistry. And I was wondering, I always thought to myself, if I was a man, if I was afraid of the dentist, and I didn't want a shot, and I didn't want to get hurt, and I saw this short, fat, bald guy, Howard, and this really sweet, beautiful woman named Shelley, I just would naturally pick you instead of me. Do you think being a woman, do you think in an industry that's tarnished with fear and pain and hurt and shot, and women are just biologically more maternal, and I noticed when my 4 boys were little, we'd be playing all day long, but the minute they fell down and got hurt, they ran and started crying. They ran around me and went straight to their mom. Do you think it's a huge advantage to be a woman graduating from dental school now as opposed to being a male?
Yes, I felt that way since the day I graduated. I just, when I was working with my pediatric patient who had giant hands and working on these little tiny kids, he told me, you're going to have to retract, you're going to have to do this. And there were times when I'd go, just hand me the drill, man, let me get in there and do that for you. He was awful at it. He said, I'm never going to practice pediatric dentistry then I graduate. And I love kids. I won the pediatric award in school. I was like, why? I don't want to do pediatrics. Why are you guys giving me this award? And they're like, you don't realize how good you get along with your patients. And I know having a child made me way better on doing pediatric dentistry, because now I have something to relate to them. I say, oh, tell me about your kitties and puppies, and what pets do you have, and what games do you like to play? And I know all the questions to ask kids now. So sometimes I think men are a little afraid to get down on that personal level. Now, I can't say that in general, because I see plenty of guys who do a fabulous job with kids, and I sit there and learn. The best example of how to do pediatric dentistry is Marvin Berman. If you could get him on a podcast, oh my gosh, he is amazing. He's out of Chicago. He's retired, but I bet YouTube has plenty of videos. Best guy I ever learned pediatric dentistry from, and he's a non-sedation guy. He's crazy. Best class I ever took. 8 hours sitting there, totally enthralled talking to him. So, I would aspire to be the Marvin Berman with kids. I'm not that good, but he's the best. He's the best example. If you're not doing good with kids, go look up some Marvin Berman videos. Hands down, best guy I've ever seen. But I think women in general, we have smaller, thinner fingers. We tend to be taught from an early age to have a lot of emotional intelligence, and we feel things out a little bit. Like when patients come in, the first thing I try to do is get in tune with where they are fear-wise. And I don't know that a lot of men that just kind of plow in, sit down, lean them back, and they don't even talk to the patient. By the time somebody sits down, my assistant's over there like, oh my God, she's talking to him again. It's going to be 5 more minutes. I tell them, sometimes when I see my assistant being frustrated and I know I'm going to talk to this patient for another couple of minutes, I'm like, I got this, come back in a few minutes, give them a chance to go sterilize some instruments, and and spend the time to really get to know people, and you'll make a patient for life. Just spending those 3 to 5 minutes on a really scary filling appointment makes them feel so at ease. And the other thing I do is when I'm drilling on that patient, I also talk to my dental assistant. I talk about, what was on the Beverly Hills Housewives last night, and I talk about, did you see what Trump did yesterday on the news? Did you see how those terrorists blew that up? I really try to stay current on events, have conversations with my dental assistant. I talk about gossipy things sometimes. And by the end of the appointment, my patient sits up and is like, wow, that was very distracting and good. I really liked how you guys did that. Just do that talky thing that y'all do. I hear that all the time. Just do that conversation, because it really takes my mind off of what you're doing. I don't know how a lot of men do that much talking while they're working, but for me, it works great with my patients.
Hey, I want to ask you. This question is coming out of left field. In my backyard, Arizona, the Arizona State Dental Association just had a big conference called Women's Issues in Dentistry. Now, they couldn't hold a conference like that, or say bald dentist issues in dentistry, or fat bald dentist issues in dentistry. So to have a conference on that and have it massively well attended, because I'm prefacing this because I don't want some woman in dental school listening saying, well, why is he asking that? We don't have any issues. But here's the data. I mean, they're having conferences with hundreds of people coming where the headline is Women's Issues in Dentistry, and it's all women speakers. So I'm a male. I have no credibility. Do women have any special or different issues becoming a dentist as opposed to someone who's a male?
Yeah, when I first
or do you think that's just a bunch of overrated crap hype?
No. I know years ago when I was told in high school, women aren't dentists. What are you talking about? And they were right. I hadn't even met one. But in my world, I don't look at things as male and female oriented. But society does. So a lot of older patients are going to go for the fat balding guy who's funny as hell. They're not going to go for that girl who's got makeup on and her hair's all fixed. They want that old style credit. Men have more credibility just because of the way society stereotypes men versus women. We also don't make as much money. And I'll put it like this. When you're the mom of a baby infant, all right, who you're breastfeeding for the first year of life, you can't sit there and work 8 to 10 hour days. You've got to get home. When I first had my child, I would breastfeed in the morning, run to work 3 hours, take a 15-minute break, pump, do the breast pump, go another 3 hours, and race my butt home to breastfeed my kid again. And usually by the time I got home, she was crying, hungry, the whole bit. I don't take lunches even to this day. I work straight through, but I do 6-hour days, and because I would rather spend my lunchtime, food time home with my kid. I have snacks all over the office. We're supposed to do little meals all day long anyway, so that's what's worked best for me being a mom. I can't work a lot of Saturdays. I missed a lot of soccer games, and so we have a lot of different issues, I think, just based on the pressure that we're still supposed to be super mom and that, that confident dentist person. And we also, especially like a lot of the dentists that I see coming out of school, when I was at a recent attendance of the whole sophomore class, I'm looking around the room. I turned to the guy who's the clinic director and I said, oh my God, I've never seen this many women before. He said, yes, our class is 53% women. In my day, we were 24% of our class, and that was unheard of. They never even come close to that before. Nowadays, they're over 50%. I'm looking around the room. It looks like a Victoria's Secret convention. They're beautiful. They're they're tall, statuesque, and they're so smart, and they come up with the best questions. They're the ones packing my office when I offer that mentorship thing. Almost all of them are female who are coming in to see me. A lot of the guys will email me and stuff, but the women are good at that interpersonal connection. They just like to reach out and get to know you on that level. All of my little mentees that have really stuck to it have all been women. So we have the need, I think, for connection. That's why I think we do well in dentistry, because it's such an interpersonal type of relationship.
But, back to, we were saying at the beginning that, OBGYN went from all male to all women. Pediatric dentistry, I mean, you look at their entrance classes, I mean, it's pretty much all women. You go to several of these, it's 50% in the United States, but many of these countries that I go to, India, Kathmandu, Russia, Poland, they're over 80% women now.
Wow.
There's 25 countries that have over a 80% woman percentage now, and I just think that with the I don't know, I think it's going to go the way of OBGYN and pediatrics. I really do.
I can see exactly your point. I think that's a shame, because the thing that frustrates me about female dentists, and I have several friends like this, is they'll go out and they'll work for 2 to 10 years. Then they start to have kids, more than one, and then they take like several years off. I have many friends who've not come back to dentistry. And the minute their husbands divorce them, which we're looking at 50 to 70% of those marriages ending, now all of a sudden they're in this panic. They don't have any skills. They've been out of dentistry for 10 to 20 years, and they come back and they have to go full blast. And they're very scared. You think you're scared coming out of school? Try not practicing dentistry for 10 years and see how you feel. They don't even know what the latest composites are. They don't even know if we still use Hemodent. There's lots of things that they get very out of date on. And what's going to happen is that if we have all these men coming out, their longevity is very low in comparison to a man who's going to practice 50 years before he retires. I'm one of the few exceptions, and a lot of women who've been in practice 26 years. There aren't very many people who have stayed with it like I have. They've gotten married, they're married to a wealthy guy, or they go work part-time and they teach, and they just don't apply that full-time work ethic to a job.
Yeah, I tell the young men in dental school, I said, if they were smart, if I could go back into dental school, I would have married one of the girls in my class and divorced her after 20 years, and just retired. I mean, that's what you got to do in dental school. You got to marry the girl who's going to make the most money, and then divorce her. We need to balance out. So
you guys are always trying to marry the hot hygienist. Now it's come back to bite you in the butt.
What? Why is that? Why is it biting?
They don't make any money. They just pop out babies.
Oh, is that right? You got to marry the woman does. How did you get, another one of your big expertise is celiac dentistry. How did you get interested in celiac dentistry, and how is that related to the mouth and oral health and dentistry?
So my daughter
You're talking about celiac sprue.
Right, exactly. Celiac disease is like, where you can't ingest gluten without having your bowels get inflamed, and
so
you don't.
Is it no longer called celiac sprue? Is it now celiac disease?
Right, celiac disease is the new term for it. They'll still call it sprue, but that tends to be physicians who are 60 and above, let's say. But almost every
I almost qualify for that.
Okay.
Yeah, I've heard. Okay.
We were taught in school it was called sprue. So I'm 52. So
and this is gluten,
let's say 50 and above.
And this is gluten, which is found in
wheat products. Wheat, barley, and rye are the three products that have gluten in it. It's a protein in like the little wheat husk. It's the protein component. It's a really long, like 33 long strand of polypeptide chain. And what happens is, as that goes through the small intestine, the cilia it actually penetrates down into the cilia and gets into the internal lining of the intestine, and your body thinks it's a foreign agent, like a virus or something, and it bursts out with a big immune response with T cells and all kinds of tumor releasing, enzymes, and it actually tears up the internal lining of the small intestine. And now it's all inflamed. The cilia just disintegrate down to where now there's very little absorption in these little tiny cilia. You want the long cilia where you can absorb on this whole surface. So now it's all shrunk down and you're not absorbing nutrients. You're not getting vitamin D, and so you start getting osteoporosis. You're not getting vitamin B, so you start, seeing oral changes. So like about 75% of celiac patients over the course of their lifetime will start to get large aphthous ulcers in their mouth. So when you try different things and it's not toothpaste and it's not, acidic foods and all of that, and you're still getting these, painful aphthous ulcers, that's when you need to start looking at the fact that they probably might have some celiac disease. You'll also see, because they don't absorb calcium and different products like that, as their teeth develop, like if they're a child and they're having celiac inflammation of the bowels, they're not going to be absorbing nutrients, and the teeth don't form as well. So when you see decalcification or mottling of the enamel edge on the first molars and the two central incisors, that's one of the biggest indications that might be a celiac patient. You get the 15 to 25% of them have herpetic dermatitis. It's like a dermatitis, and it looks like a herpes rash, like a really bad seborrheic dermatitis or something. It looks like little pimples on the skin. If they have seborrheic dermatitis, they will end up with a positive identification for celiac disease. There's a lot of blood tests that you can do for celiac disease. The best ones are the IgA-EMA and the -TTG. Those are the two best blood tests. Unfortunately, those are very expensive. And my daughter did some of the blood testing that was a lot less refined, and they gave her this positive diagnosis of celiac disease, and that's why I've had to get so up on the topic. But in the end, we found out it was more of an anxiety, irritable bowel type of syndrome. So, but what I realized during all of my readings, like I've read over 100 articles on celiac disease and how it affects the body. You name it. If you've got a patient where you see they have all these immunological diseases, like thyroid disease, diabetes, even MMR patients are also at high risk for celiac disease, or if anyone in their family has
MMR
celiac,
stands for?
mental retardation.
Oh, really? That's a new
Yeah.
MMR?
Yes. Yeah. Sorry, I'm not thinking of the name right now, but that's what my retardation folks.
Is that mongoloid? Mongoloid mental?
Yeah. Anybody with Down syndrome, trisomy, any
That's
of
in
that
the same
stuff.
cluster with thyroid, diabetes?
No. Yeah. Well, I'm just saying they're at a higher risk. Those types of patients are. A lot of the people who I know who have celiac disease were in their 70s before they got a diagnosis. And when I would go talk to them about it, they would say, I'm really glad you're talking about the aphthous ulcers and the swollen tongue and all of the vitamin deficiency problems that we would see, because they said, I've had all those symptoms throughout my whole life. They almost all have some form of diarrhea. They're just, nothing gets absorbed. It just goes right on through. Their bowels are all inflamed and painful. Their bellies are swollen. You look at a little kid and they look like one of those African kids with the stomach sticking way out. It's sad, and a lot of the GI doctors don't know what they're talking about. We got a bad diagnosis from a GI doctor. So, there are very few. What I tell patients is if they have a lot of diarrhea, I see modeling, or I see that those teeth that I'm talking about are all crowned. And I'm like, why did they crown those, why did they crown all your first molars are all crowned? What happened? I don't know. They just came in and they looked weird and they had all these weird spots on them. Those kind of signs are things to look for.
And
if we could catch kids at a really young age by seeing they have aphthous ulcers, they have diarrhea, all of their incisors look goofy, that would be a great thing. Like, let's go run these 2 blood tests on them and see what we can find out here.
Is there a racial component to this? Because I was noticing when I was lecturing in Ireland, the grocery stores all had a celiac or gluten-free section. I mean, this is going way back in the day. And an Irish dentist told me that the Irish have more celiac than any other group of people. Have you heard that?
It's not Ireland, but it's Northern Europe, like, the Danish, and I think the Danish had one of the higher instances, like Norwegians, Finland, Sweden, all of that area, huge components up there. In America, we're in the 1 to 2% might have some of the genetic components. There are 2 genes that you can have. If you don't have them, there's no way you can have celiac disease. So, like, we finally genetically tested my daughter. She didn't have either gene, so there's no physical way that she had celiac disease. But you can have these 2 genes, and if you have one, it can be expressed as celiac disease. It might not be, but you can still pass this down to your child. So there's a lot. You have to have the genetic component. So you can imagine that a mass of the world has all of these genetic components, and they're breeding with people who have the genetic components. So you're going to have a higher expression of a dormant gene.
And genes are very important. I've noticed all 4 of my boys are batshit crazy. And I think
I like Ryan, though.
You like Ryan?
He's going to be a good husband someday. He was patient with this blonde girl in the computer.
Ryan is a fine young man. So basically, this is only a disease, though, because you don't live in China. I mean, if you move to a rice-based society,
perfect.
So if you got celiac free, you should just move to Shenzhen, and you'd be set.
Fish and rice, and you're set. Yeah, because it's all about the wheat. Elizabeth Hasselbeck, when she came to popularity because she was on one of the Survivor shows, and when they put her out on this remote Australian island where she had to eat, dirt, she said best she ever felt in her whole life. And then the show ended, and she went back home to New York, where they had this big family reunion to celebrate her getting off the show. And what did they serve? All pasta. She immediately, after she ate that meal, got brutally sick. And it was because her gut had finally healed on a gluten-free based diet. And she went back home, had a whole bunch of wheat pasta, and was instantly sick. And that's when she found out she had celiac disease.
I was also one time talking to a dermatologist. This was way back in the day. It was about 20 years ago. And he was telling me that he'd read this paper where a dermatologist, epidemiologist went all over the world. And whenever they went to island countries with zero processed food, there was zero acne.
Oh, I bet, yeah.
And he said when
lots of stuff.
Yeah, and he says then you come to a country like America where they only eat processed foods. They say, oh, it's your hormones. He's going into heat. He's a teenager. And I'm sure everything's more complex than a simple vertical.
No, it's all that GMO stuff and all the chemicals they add. Look at how they have changed. I've done a lot of research through the Girl Scouts on food, but if you look at how much we've changed how we do even milk production, and, cows are eating, modified grain, and then they're fed all these antibiotics and all that stuff. And all of the people who now have lactose intolerance, I mean, back when you and I were growing up, none of our friends had food allergies. And now every other kid I meet has a food allergy.
And the autism rate's gone off the charts.
And the what?
The autism rate has gone off the charts.
It's
Hey,
crazy.
I want to say another male female thing. You know, it's so easy. Back when we were little, everything was they were breaking up markets by Chinese, Hispanic, white, whatever. And then they got into the male female. But you said something when about do women have a competitive advantage? And you said with older people might think a male. And everything I'm reading on elite market segmentation is based on how the difference in the senior citizens think versus the baby boomers or the Generation Xers, the millennials, and it doesn't really. So many things correlate with how they think. But I think a lot of male dentists, if you say alternative medicine, naturopath, anything like that, they just like you're a quack. But when I look at marketing, I see still women making 90% of all the dental appointments, and
Right.
I see the older males, basically the older male dentists who always are ranking on the naturopaths. I mean, I'll be honest with myself, I have almost no faith in the American healthcare system. I mean, I won't take any prescription pills. And you go in there, they're just going to fillet you open, give you a stent, give you a bite. It's
The
just, I
new
mean,
hip,
yeah,
nobody wants to fix anything anymore. They just want to replace it. It's
I
like
know,
the TV.
I know,
There's no TV repairman anymore.
and you hear all these dentists saying, that they don't want to get on 5, 6, 7 chronic prescriptions and playing that game. But when you say to that older dentist, hey, what do you think of alternative medicine or naturopath or whatever, they go ballistic. But I see dentists who basically do dentistry the same as you and I, but on their website, ask about alternative dentistry or ask about more natural alternatives. They start using those zing words. In fact, I know one dentist in the very competitive San Francisco that all he did was take his dental office off the grid with solar panels and was bragging about how he's an environmental friendly dentist and he's off the grid and they recycle everything. He says those are the biggest freaks that people drive an hour just to record him for being eco-friendly. So I was going to ask you, do you think, so all that long-winded crap was to get to this question, do you think women making dental appointments would be more interested in a dentist who talked about more natural remedies or alternative things or
One thing I've learned early on in my career was all the people who healed super well after an extraction were my vitamin freak patients. I mean, like I do a surgical extraction on somebody, have 3 stitches in them. They come back 7 days later, back in the old days when we took out the silk sutures, and they looked like they'd healed up a month. I'm like, what have you done differently? Oh, I'm kind of a vitamin C freak. Every person who had that, I had a lady who did oral sprays with vitamin C. She had some of the worst type 4 perio I've ever seen, and I'm probing her gums and not one bleeding point. Yet I'm hammering on calculus down there. Her gums look amazing with vitamin C. So I became early on convinced that vitamins would really help. And the point with vitamins is not all are absorbed equally. If I've learned anything through my celiac studies, it's that vitamins go through the intestinal wall in a clump. And you want to get a vitamin that's nano encapsulated so that it breaks down and gets absorbed by the cilia a lot better than a clump that just kind of goes along and you just absorb what's on the outer edge of the clump. So vitamins make a world of difference in a lot of things. And when I see a patient who's got, the red inflamed gums, they have macular degeneration, there's all kinds of different vitamin related things, like even a patient maybe with some thyroid disease, maybe they need some more iodine in their diet. There's all kinds of things that we need to now go get more versed on because the science wasn't there back in our day. It is now. And if you're not keeping up with continuing education, you're going to be practicing, you're still going to be putting copolite in a prep and sealing up the amalgam, I don't even own those things in my practice anymore. I wouldn't be caught dead with them.
I'm a big believer in cranberry juice. I just think cranberry juice is good for every organ in your body. So every night before I go to bed, I always have a double Grey Goose with a splash of cranberry, just
I think
just
that's
for
a
that alternative
genius,
medicine.
Howard.
Hey, but it's funny you said that because you the first medicine ever invented on Earth was actually vitamin C. It's in fact, C stands for citrus. It was the British physician who noticed one ship came back and nobody had scurvy, and they
Right.
surveyed the whole ship, and the only thing they found in there was a barrel of limes, which is why to this day a British sailor is still called a limey. And he
Right.
went to the king and he said, he explained this to him, and he said, next time the ships go out, I want half the ships with limes and the other half without. And then 3 years later, they came back, and the ship without the limes had the standard 25% mortality rate. And so that was the first medicine. It was the man-made observation that one boat came back with no scurvy, and that physician put it together to a lime. Um, that is just amazing. So back to the original question of this deal. Do you think that graduating from dentistry in 2016 is just as good as when you got out in 1989?
I think it's way better, Howard, because like now you can do implants. I love doing implants. You can do veneers. You've got porcelains. Back in our day, you had copalite, amalgam. You remember when we would mix together the composite catalyst and base? They're still doing that in the prisons. It's sad, but don't get me started on that. We have so many new things. In 1981. I had a diastema between 8 and 9. Ortho hadn't closed it. My dentist, Dr. Bill Lockard, said, hang tight, and I'm going to go put this new thing on you. And it was the old NuvaFil light cured composite. I don't know if you remember NuvaFil.
I do.
Put it on my two front teeth. Honey, it's still there to this day. So the stuff that was just coming out when you and I were graduating, I was one of 3 people who took a class called Dentin Bonding my senior year of 1989. That's all we do now. Everything I learned in dental school outside of Crown and Bridge prep is pretty much out the window. Dentistry has changed so much more exciting, I think.
You
now.
walked into you talked about prison dentistry. I want to go there because Ryan, we've had so many emails. We're trying to get that girl, Dr. Shannon Wieners. I did Ironman with her father, Randy. Yeah, one of my Ironman buddies had 6 daughters, and one of them's a dentist, and she worked in prison dentistry. But didn't you actually know the famous orthodontist who went to prison?
Oh yeah, I got a letter from her last week, Dr. Clara Harris, the dentist who ran over her orthodontist husband in Clear Lake, Texas.
Clara Harris was her name?
Yep.
And she was from Venezuela, or was it? Or
Colombia.
Colombia?
Bogota.
Was she an orthodontist or a general dentist?
No, her husband was. She's a GP. We did our general practice residencies a year apart. That's how we became really good friends. One of the finest people I know, still to this day. We think she's going to get out this summer. It'll have been 13 years since she killed him. Well, convicted, let's say. Okay, when that first started, about a couple of years, 3-4 years into Clara being incarcerated, she fractured off the whole lingual of number 15. The dentist there was I'm not kidding, putting formicrosol on the surface of the tooth and putting some IRM on it. Who puts formicrosol on a live tooth?
Shouldn't she have just swished with coconut oil for 20 minutes?
Yeah, that works every time. I hate that. But anyway, so he was doing all this voodoo dentistry. So we went out and changed the state law so that I could go in. This is how powerful her friends are. I could go in. I did 8 crowns on Clara in the prison dentistry clinic. The stuff I saw there was frightening. They had these old curing lights. They had this I'm not kidding, the catalyst and base composite material. And I said, look, I can go, and I had Michael Miller with Reality on board to come in and donate all, like 20 curing lights and all of this material. He was like, man, just go in and clean out my storage units and we'll donate it all to the prisons. They wouldn't take it. And I'm like, why? Why won't you take free stuff? Because they all have to be identical. They all have to be approved through our formulary. And it can't be, various materials that could be used as weapons and yada yada. It drove me crazy. It was really a very awful experience. For her, it was one of the greatest things I could have ever done for her. Every day, she said, sitting there in my chair, she was the best patient. She said, when you're here working on me, that's my mental escape for the day. I get to be transported to a place where people care for me. So seeing that what this population of people, it's a very enriching, rewarding experience, as long as you're not too worked up about the materials you get to use.
Yeah, it's funny how no good deed ever goes unpunished. Did you see Lenny Kravitz? He went to the Bahamas and set up a charity dental clinic, and they shut it down because he didn't have the right permits and papers.
It's sad.
It's like here's Lenny Kravitz trying to do a good thing. So what's the story on what's the life lesson on Claire Harris? I mean, can really good people just snap and do something terribly bad,
Totally.
and they're really a good person? They just snapped, or what's your make of that? I mean, she did run over.
She ran over him, but everybody thinks she went chasing him down. She didn't. She went on the other side of a car. He jumped out to stop her, and she was going 10, 15 miles an hour, and he went under the car. And she did not do this multiple drive over thing. She ran over.
She drove around 3 times.
Right. No, she drove around the parking lot 3 times because she's freaking out about what just probably happened, and she was really losing it. There's no way I can explain the losing it part. And she'll tell you, I don't have any memory of what happened after David jumped out and stopped me. I think she knew in the back of her mind that she had run over him accidentally, but she took her car over there to bash the car of the lady he was cheating with. It didn't have anything to do with wanting to run David over. And the running around the parking lot and doing all that, she's actually running over parking little hubs in the parking lot, not bodies.
Well, I have to tell you that when I met the mother of my 4 children when I was 14. We were married for 20 years, and she's still very, very, very bitter about the divorce because she didn't want a divorce. She wanted a funeral. So
I can relate.
She can take driving lessons from Clara. So what is Clara going to do when she gets out?
She's been doing Braille in prison, so she takes textbooks and she converts them to Braille for blind children or visually impaired children. Every state has to provide that by law for the blind population.
Well, I two things on you. We just started on Dentaltown a mentorship program. The dentists on Dentaltown have been pioneering this mentorship program. We just launched it, and it's all the buzz. And I was wondering if you would just look at it. And since you're the most mentor expert I've ever known or heard of, and like I say, it started on Dentaltown, it started on a message board thread, and they were saying, why don't you do this and that? And we just started that, and I would love for you to take a look at it and see what you think. I would also any chance the whole continuing education is moving online because you don't have to close down your dental office and fly to a different city. We put up 350 courses. They've been viewed over 500,000 times. Anyway, we could score an online CE course from you. I could see you doing one on 4 young dentists, and I could see you doing another presentation on celiac disease and dentistry.
I would love to do it, Howard. Let's have Ryan get in touch with me, and I'll set it all up.
All right, Ryan, just email her, and so there's 2 Howards at Dentaltown, Howard at dentaltown.com, but Howard Goldstein, he goes by Hogo at dentaltown.com. Hey, what if one of these kids listening to me wanted to talk to you? How could are they allowed to contact you?
Of course. My cell phone number is 713-5553-6476, and my email is drcanada, that's CANADA, at me.com, me.com. So it's drcanada@me.com.
So is the question a little redundant to say, are you Canadian? I mean,
No.
I mean, you can't ask someone, where does the name Canada come from?
It's German. I don't know. German, it means canal dweller.
Canal drill. So is that what Canada is named after? Is that a German
No,
name?
no, that's named after some old Indian name. It's an Indian tribe name up there. So they're
Well,
not
we're talking
related.
about Lenny Kravitz getting shut down in the Bahamas, and Canadians like to go to the Bahamas because they're known as fella because they come from Canada, which is Canada. So they go to the Bahamas, which is Bahama. And I heard that from a bartender in the Bahamas. But Shelley, hey, seriously, our hour is up. Thanks for being my idol and rock star mentor
You're
for
my
30
idol, Howard.
years. Please take a look at Dental Town's new mentor program because
I will. I'll get on it this week.
if it needs tweaked or anything, I'd love to hear from the expert herself. But man, if we could score an online C course or two, I would love to have one on young dentists. You know,
Great. I
do's
have a
and
lot of
don'ts for
material.
young dentists. In fact, Dental Town. Most people wouldn't know this because we only send dentistry, but once a year we have a new grad issue. So every year the 5,000 grads walk out, and we send them a special issue of Dental Town of just issues towards the new grad. I could see that working tying in with that, where they sit there and say, "Go on to Dilltown, and what's his course? New grad issues from Shelley, Canada." But hey, it's an honor to meet the dentist that they named Canada after, Shelley, Canada. Thank you so much for spending an hour with me today.
Yeah, my pleasure. I love it. Thank you for all you do for dentistry.
And tell Michael Miller and his wife Ingrid.
He's next.
Yeah, and I'd like to meet see Clara when she gets out.
I will.
That'd
When
be
she
an
gets
amazing
out, we'll
story.
put her on and we'll talk about what she's seen about prison dentistry and what the population's needs are. She'd love to do that.